So it looks like we have pretty much everyone in from the lobby. So just wanted to welcome everyone. And this is our first session in a series, Maintaining Compliance, the Standards Revision webinar series. We're thrilled to have you guys join us today. And we're going to be exploring some really important updates to Quad A's accreditation standards and what that means for your facility. I'm Emily Pounds, and I'm the Director of Education here at Quad A, and I'll be your host today. This session is really designed to help you understand the latest changes, how that impacts the different healthcare settings that we serve, and the steps you can take in order to maintain compliance. So we're honored to have Quad A CEO, Tom Terranova, here today. He'll be leading the presentation. He's going to walk us through some key updates and provide insights on how these changes enhance patient safety and operational efficiencies. After Tom's presentation, we'll have an open Q&A session, and he will be joined by a panel of Quad A experts, and they'll be able to answer all of your questions, hopefully. So I do have a couple of housekeeping notes. As you can see, you can submit your questions at any time using the Q&A function. We'll try to answer as many of those questions as possible during the Q&A segment. And any answers that we have that go unanswered, we will send those in a follow-up email. And then just as a side note, this session is being recorded today, and all of the registrants that registered for this, regardless of whether they're here or not today, they will get an email with the link and the recording as well as the slides from today. So with that, let's get started. And Tom, I'll turn it over to you.
Thank you very much, Emily, for the introduction. And also, I just want to make a note to our team. I think people are still joining the lobby. So throughout the presentation, as the lobby continues to accrue, let's just be aware to keep admitting all those folks so that they can get in to see what it is we're talking about. As Emily said, I'm Tom Terranova, CEO of Quad A. I often say at the beginning of my presentations that I've been with Quad A since 2009 in just about every role and capacity you can imagine. So about 16, 15 years of experience with Quad A, and I've been in my current role since 2019. I'm honored to be kicking off this important webinar series, Maintaining Compliance, Quad A Standards Revisions. First off, thank you for taking the time to join us. Whether you're a clinical leader, administrator, or part of the support team, we know how critical your role is in upholding quality and safety standards. This survey was built by our incredible team with you in mind. As many of you know, staying up to date with evolving compliance requirements isn't just about passing a survey, it's about delivering safe, effective care every day. And with recent revisions to the Quad A standards, now is the perfect time to dive into what's changed, what it means for your practice or facility, and how to stay ahead. Over the course of this series, we'll walk through the updates section by section, break down what's new, and offer actionable steps to help you stay compliant and confident. Our goal is to make the standards feel approachable and applicable, not just another checklist. And I want to take a quick moment to say that this talk today is both longer and more conceptual than the ones that will follow in the series. We'll go a little bit deeper into this series in just a few slides, but we're going to be here for an hour today. The follow-up remaining sessions will be about 30 minutes to make this much more digestible and approachable so that you can bake it into your day or that you can watch it on demand as you please without really overwhelming your day. Also, we will dig far more into detail into specific programs or areas of compliance or areas of the new survey processes and standards in the future sessions. What we're doing here today is setting up the foundation so that we can approach the standards changes and compliance in a consistent way as we move forward. Before we truly dive in, I want to take a moment to address an important note regarding the content we'll be covering throughout the series. The requirements outlined in the current version of the Quad A standards supersede all previous versions. That includes interpretive guidance that may have been shared in past newsletters, webinars, or even in direct responses to standards-related questions. So as we move forward, please be sure you're referencing the most recent standards and using this updated information as your go-to resource. Our goal is to provide you with the most accurate and up-to-date guidance available so you can maintain compliance with confidence. If there's ever a conflict between something you've previously read or heard and what's in the current standards and interpretive guidance take precedence. If you're not Sure, if it's unclear, please contact our staff, show them whatever previous guidance you've received, and ask for clarification as to whether they're still in force. I want to take a second there here to emphasize that this goes for standards as well. In my 15 years at Quad A, I can tell you the number of times that I've heard the term grandfathering, that a facility has been grandfathered in by being older or having previous accreditation. The concept of grandfathering does not apply to Quad A standards. Just as science, technology, and healthcare advance, so do the expectations for compliance. So there's no such thing as grandfathering in, such that standards would apply to a facility just applying for accreditation the same way they apply to a facility that's been accredited for 35 years. Here's a quick look at what we'll be covering in today's session. First, we'll start with the series overview, what this webinar series is all about, how it's structured, and what you can expect in sessions to come. Next, we'll provide a brief refresher about Quad A, who we are, what we do, and why these standards matter so much to patient safety and quality care. Then, we'll dive into the heart of today's presentation, understanding the updated standards. We'll walk through key revisions, highlight what's changed, and explain the rationale behind the updates so you can implement them with clarity and with confidence. Finally, we'll wrap up with an open Q&A panel discussion with our experts. This is your chance to ask questions, clarify points, and hear directly from those involved in developing and interpreting the standards, as well as applying them in the field. We're excited to get started, so let's jump in. You'll notice the visual here is a puzzle, and that's intentional because I know that it can seem like putting a very large, complicated puzzle together to maintain compliance all the time. But here what we're talking about is each session in our series. They are designed with a distinct piece of the overall picture. They're all designed to fit together to give you a complete and comprehensive understanding of the updated Quad A standards and survey processes. Every piece has a purpose, whether it's walking through foundational knowledge like today, unpacking specific revisions, or giving you a chance to hear directly from our experts. Each part builds upon the last to form a well-rounded, actionable learning experience. The puzzle format is meant to reflect how these topics are interconnected. Compliance isn't just one thing or another. It's the sum of all of these parts working in sync. So whether you're joining us for just one session or the full series, know that each segment you attend is designed to give you practical tools and insights and confidence in your role within this bigger picture of compliance. As we walk through the schedule for this series, I want to emphasize that it's designed to be flexible. You can engage in the way that makes the most sense for you. Each session is focused on a different aspect of the updated Quad A standards, and we know that not every segment will apply to every attendee. If you only want to attend sessions that directly align with your facility type or your role, that makes total sense, and we absolutely encourage you to do that. For example, if you're part of an ambulatory surgery center, the non-Medicare segment happening on April 23rd likely does not apply to your day-to-day. It'd be perfectly reasonable for you to skip that one. That said, if you're the type of person who wants to attend every single session, either to gain a broader understanding or because you're just curious, that's totally welcome too. You're more than welcome to stay with us throughout the whole series. Whether you're here for a piece or for the full puzzle, we're glad you're here, and we want you to get the most of your time with us. Now that we've walked through the structure of this series and what you can expect, let's shift into the heart of why we're here. Quad A's accreditation standards are changing, and these aren't just service level updates. This is a broader move toward greater clarity, consistency, and alignment with current best practices in healthcare. So the real question is, are you ready? That's the purpose of the entire series, to equip you with knowledge and tools and confidence to understand these changes, to successfully implement changes required in your daily work, and in today's session, we're laying the foundation. Before we get into the specific revisions, we'll explore the background of this project, how it began, and what drove the updates, and the goals behind restructuring our standards. When it comes to meaningful change, understanding the why is often just as important as understanding the what. So with that in mind, let's take a closer look. Your learning objectives for today are to gain a clear understanding of Quad A's latest accreditation updates, including new compliance requirements and revised protocols, to identify how these updates affect various healthcare settings and operational workflows, and to learn proactive strategies to address potential compliance challenges and to maintain long-term accreditation success. Our goal is always to set you up to succeed long-term, not just the day of survey. Understanding Quad A's mission, vision, and role as an accreditor provides important context for you and for these changes. So it also helps explain why consistency, clarity, and quality are at the core of everything we're updating. For most of you, I'll assume you know this and we'll go quickly through it, but there may be some new folks who are applying to Quad A or have just recently joined as an accredited organization. Quad A has worked with thousands of healthcare facilities around the world to standardize and improve the quality of healthcare they provide. Believing that patient safety should always come first, at Quad A, the goal is simple: to be your go-to provider when it comes to accreditation. As many of you know, Quad A is a global accreditation organization. Our objective is to take a scientific approach to standards that has a consistency around the world, not to take a regional or national approach. Since our establishment in 1980 as a nonprofit, physician-founded and led organization, Quad A has always put patients first, always. That means, and I can tell you with direct certainty and firsthand experience, that our board of directors and Quad A leadership has time and again put Quad A's own growth and financial well-being as a second priority when opportunities or proposals or options have become available that might compromise patient safety. The program is designed to be peer-based so that the people providing surveys are operating in the same type of environment as the facilities being surveyed, so they can provide an educational and non-punitive approach to compliance. Our 100% compliance mandate sets us apart because it's very easy. We all know how simple it is to set a great plan to implement corrective actions and to put plans moving forward to achieve and maintain compliance, but to become really bogged down with the busy day-to-day tasks of running an organization and have a hard time maintaining that momentum. And so that 100% compliance mandate puts Quad A as your partner as you implement changes to make sure that you're on solid footing going forward. And our commitment to scope of practice and specialty training also helps make sure that patients receive care from providers who are eminently prepared to provide that type of service. Again, our goal is to drive continuous quality improvement. For those of you who've been around a long time, or those of you who are relatively new to Quad A, you may or may not be aware that Quad A has 3 CMS, that's the Centers for Medicare and Medicaid Services, approved programs. Our ambulatory surgery program has been in existence and approved by Medicare since 1997. Our outpatient physical therapy and speech pathology program since 2011, and our rural health clinic program since 2012. Additionally, Quad A carries IEEA accreditation from the International Society for Quality in Healthcare since 2015, in addition to dozens of state and governmental approvals in specific jurisdictions to carry out its programs. What this means is that Quad A repeatedly puts itself through the same type of paces and rigorous programs that we put you through as facilities. So we get it. We know what you're going through when you're being assessed, because we are consistently being assessed by one or more of our regulatory contacts to make sure that our program is up to speed, the quality is up to par, and that we are consistent. Now that you've got a sense of who Quad A is and what we stand for, let's dive into the background of the Standards Overhaul Project. This was not a simple refresh or routine update. This was a comprehensive, intentional focus and an intentional effort to restructure and modernize the standards to better reflect today's healthcare environment. In the next section, we'll walk you through how the project began, the key drivers behind it, and who was involved, and the guiding principles that shaped the entire process. Understanding this background will help frame everything we cover moving forward, not just today, but over the next 8 weeks should you choose to join us. Let's take a closer look how this all came together. Now that we've introduced the scope and intent of the standards overhaul, let's take a step back and talk about how we got here and why the project was necessary. The truth is, a major comprehensive review of the Quad A standards hadn't been completed in many years. While smaller updates were made periodically and on an as-needed basis, it became increasingly clear that a more intentional and structured overhaul was needed to keep pace with modern healthcare demands. This project began as part of a broader goal to streamline, clarify, and modernize our standards across all programs, You'll notice on the timeline here that we start from 2023, which is when the overhaul project itself began. But it actually has a preceding project, which we call the consolidation project, that started in 2020. As many of you know, and as we've outlined previously, Quad A has about 10 distinct programs that exist all on their own. The projects to keep all of those standards up to date are incredibly complicated and incredibly cumbersome. So the first project was the consolidation of all of those standards to put them in a single compendium so that our standards committee can review and assess each standard as it applies across all 10 of our programs on an ongoing basis. And that really set the stage for the 2023 beginning of the overhaul. Although Quad A consistently reviews standards with input from facilities, surveyors, board members, and staff, this time we took a much more comprehensive and collaborative approach. As part of our standards review process, which occurs formally every 3 years, we committed to not only reviewing the content, but rethinking the structure of our standards and our manual. This means identifying and removing redundancies, clarifying vague language, and ensuring greater consistency across each and every one of our accreditation programs. This effort wasn't just about wordsmithing. It was about modernizing how standards are used and applied in the field. We wanted to make them more practical, user-friendly, and better aligned with the regulatory and operational realities. To support that, we introduced several new tools, including a more robust glossary, detailed Quad A specific interpretive guidelines, and reference points to accompany those interpretive guidelines, all aimed at making standards easier to understand and implement. The version you're seeing today is a result of that effort, built on feedback from the field, best practice alignment, and a renewed focus on clarity, consistency, and clinical relevance. As part of this process, we held a public comment period, an opportunity for anyone in our accredited community or the public at large to review the proposed changes and submit feedback. That feedback was crucial. It helped us identify any areas where clarification was still needed and ensured that what we released was practical, applicable, and clear. To support transparency, we also provide change reports. These reports outline specifically what's changed, word for word, from previous versions of our accreditation standards and why. You can find these reports directly on our website, and we encourage you to refer to them as you're transitioning to the new standards. You'll be able to better target your activities if you know exactly what's changed on certain standards where others may have remained the same. Speaking of your standards manuals, if you haven't already, you can access the updated standards manuals for your program directly on the Quad A website as well. These are your go-to resource moving forward. Now, you might be wondering what's the difference between a major overhaul like this one and something much smaller. That's where technical corrections come in. These are minor changes or clarifications that don't require a full rewrite or restructure of our manual, but still need to be implemented to maintain accuracy and, in many cases, compliance with evolving regulations or best practices. There could be a severe upset, a disruption, or a technological change that requires new standards. In those cases, we might offer technical comments and technical corrections. All of our programs should expect to see some technical corrections to some extent. In fact, we've already had the first round of technical corrections posted on the Quad A website, and those are expected to be going into implementation on the exact same day as your standards manual that you've been seeing for the last few months. We'll get to the exact timeline in just a few slides. If technical corrections have been posted, it should be considered that they would be effective immediately unless there is an implementation date. We will always provide a clear implementation date so your facility has time to prepare. With the first round of technical corrections that have already been posted, again, our expected effective date will be April 7th, along with the standards manual that you've been seeing and that was available for public comments at the end of last year. Now, it's important to understand that compliance with the newly released standards is expected as of their official implementation date. However, we recognize that technical updates will continue to emerge and that there will be an evolution to this document and your compliance. As each of those are announced, we'll clearly indicate their timeline and implementation date, what will be surveyed, and when, so that you're never caught off guard. We encourage you to incorporate those changes as soon as they occur so that you can assess your own facility in your next self-evaluation and that you'll be available to present compliance information and proofs to your next surveyor when your next on-site survey is conducted. I would strongly encourage you not to wait for the pre-survey preparatory timeline, because it's just more likely to increase anxiety and give you challenges with compliance. We are committed to keeping you informed, supported, and survey ready every step of the way. Briefly speaking, the goals of this project were to streamline and remove standards with redundancies, to clarify and provide revisions to ambiguous and problematic standards, to provide interpretive guidance to help you facilities understand compliance expectations. I have already counseled several facilities not to really pay attention to requirements that are very clear and that you know how to comply with, but to really dig into the interpretive guidance anywhere that you see a problem, a friction, or something that you don't quite understand. These are intended to provide color and context to the requirements, to better detail how you can comply. On the flip side, the goal is to outline the survey procedures for how we will assess compliance with these standards for our surveyors. This same tool is to be used by our surveyors when they run into unexpected circumstances in the field, and they can use those interpretive guidelines and ideas for compliance to better create ways to test for compliance that they may not have thought of or encountered before. It's also our goal to provide additional resources, adding links for references and resources for easy access to supporting information, forms, requirements, data, all of those things related to your compliance directly in the interpretive guidance and the links that are contained therein. A big part of this is also to revise and create a more robust general glossary. The glossary ensures that we're all speaking the same language in the accreditation survey and assessment process, even when it may not be the same terms that you use in your day-to-day life, and to simplify our anesthesia class definitions. Let's take a moment to talk about the why behind the Standards Committee, why it exists, and the role it plays in maintaining the integrity of Quad A accreditation. At its core, standards set the minimum requirement for patient safety. When a patient walks into a facility that displays the Quad A accreditation logo, they can trust that safety comes first, and it's not just our tagline. This is a commitment grounded in the work of our Standards Committee as well as several other of our board committees. The Standards Committee is made up of a diverse group of professionals, including Quad A board members and subject matter experts. Together, this group ensures our standards are not only clinically sound, but also practical, consistent, and responsive to real-world challenges. Let me break down their key responsibilities. First, they work to advance patient safety and clinical excellence, prioritizing evidence-based decision-making and keeping our standards relevant to current clinical practices. Second, they help ensure that the standards are informed and practical by incorporating frontline expertise and responding to feedback we receive from facilities and surveyors. They also work to uphold consistency, integrity, and compliance, ensuring that Quad A standards are aligned with regulatory expectations from our partners and support survey readiness across all accredited programs. I can tell you firsthand that consistency is one of the biggest challenges for any accreditation or regulatory agency. Each surveyor and each facility comes with its own experiences, training, and background that can lead to a very different survey experience depending on who's conducting it. Our goal, the Standards Committee goal, and part of the goal of our interpretive guidance is to limit that variability and encourage consistency, both in the provision of care and in the assessment of compliance. In a rapidly changing healthcare environment, these folks help us stay responsive, adapting to standards, to new risks, innovations, and realities. Finally, they help us as an organization build trust and credibility in the broader medical community and with patients, something we all take very seriously because that trust is earned through transparency, rigor, and our collective continuous improvement. When we talk about the Standards Division, know that this is not a process happening in a vacuum. It is guided by experts grounded in practice and centered on what matters most: safe, high-quality care for every patient. So what makes these people who are rewriting the Quad A standards qualified to take on such a responsibility? Each member of the Standards Committee brings a deep bench of experience and expertise to the table. We're talking about individuals with exceptional educational backgrounds, professional licensures, and years of hands-on experience in their respective fields, and most often surveying dozens, if not hundreds, of Quad A accredited facilities. They're not only experts in clinical care, they're actively engaged in current medical practice or nursing practice and familiar with both Quad A standards and our approach to accreditation. That combination ensures that what we develop is grounded in real-world applicability and not just theory. Together, this group represents all of our programs and an extensive knowledge base across the healthcare spectrum. Let's break down the committee structure. First, there are Quad A board members who provide leadership and oversight to help ensure the standards align with our mission, vision, and accreditation principles. There are invited committee members that include permanent committee members as well as subject matter expertise. These folks may come from a variety of specialties and weigh in specifically as to how standards or wording affect their specific specialty or environment of practice. We also include language reviewers, and these folks' primary responsibility is to make sure that the standards are understandable to folks who haven't spent the last 6 months writing, crafting, and commenting on the standards, because we all know how easy it is to understand what we're talking about, but maybe not what somebody else is talking about. The language reviewers help to try to bridge that gap. These voices ensure clinical accuracy, program-specific clarity, and accessible language for implementation. And last, but by no means least, is the Quad A staff liaisons. This is part of the Quad A team. These members help guide the process, coordinate stakeholder input, and ensure revisions are consistent with regulatory expectations and operational realities for Quad A. I'll also add that they conduct a tremendous amount of research to make sure that there is data and evidence and literature to back up our standards, interpretive guidance, and those questions that you all may ask into our standards inbox. I'll also point out that the entire Quad A staff liaison team are registered nurses and clinicians. Importantly, this committee includes broad professional representation. We have physicians, RNs, dentists, occupational and physical therapists, speech pathologists, other healthcare professionals, all contributing from a wide variety of specialty and care settings, from anesthesia to pediatrics, from rural health to outpatient surgery. This intentional diversity in experience and perspective helps ensure that the revised standards are comprehensive, relevant, and effective for the wide variety of facilities we serve. When we say these revisions are informed, we mean it. Every line is shaped by people who live the standards and who are deeply committed to getting this right. So how did the committee determine what needed to change? The process was both methodical and collaborative. Each committee member conducted individual reviews of every program's standards manual, carefully evaluating each standard for relevance and clarity. They provided comments using a structured framework known as the Roomba method, which we'll touch on in a second. The committee then met for weekly calls, discussing each standard in detail to ensure alignment and shared understanding. I will tell you that I've heard from plenty of the committee members' spouses about the several hours a week, every week for the entirety of their summer and most of the months of last year, that the committee spent discussing and hashing out all of their concerns and questions for each and every standard. Finally, we gathered input from professional societies and associations to make sure that the updates reflect current clinical practices and industry expectations from others in the healthcare community and not just within our four walls. This was a team effort rooted in thoughtful analysis, clinical relevance, and real-world application. So the standards not only meet today's expectations, but help us move forward into the future of healthcare. Sorry, folks, when you see me clicking around, it's because I'm still getting folks joining and they're popping up in the way of my my navigation button, so I just have to get rid of them. Just a second ago, I mentioned the committee members were evaluating each standard using the Roomba method as part of the review process. So it's probably helpful to talk about just what exactly Roomba means. It's an acronym that stands for relevant, understandable, measurable, behaviorable, and achievable. It's a framework that helps ensure that every standard is thoughtfully evaluated and designed for clarity, effectiveness, and real-world application, something we've said several times. When we assess relevance, we want to know whether the standard directly supports patient safety, clinical quality, or compliance. It must be meaningful to the care being delivered and the environment it's being applied in. Whether it's understandable is the assessment of whether the language is clear, concise, and free of ambiguity. If a standard is confusing or overly technical, it becomes incredibly difficult to implement and enforce more consistently. Whether a standard is measurable. Can compliance with the standard be objectively observed and evaluated during a survey? If we can't measure it, we can't assess it. Behavioral. We want to know whether the standard describes an observable action or an expectation. This helps link the standard to real behaviors or practices within a facility that can be observed and assessed by our surveyor. And finally, is it achievable? Is the standard realistic and attainable across different facility types and settings? Standards should set the bar appropriately, not too high, not too low. We want to thread the needle here. Using the Roomba method ensures that each revision is not only well-intentioned, but practical, surveyable, and meaningful to your daily operations. Now that we've covered sort of the approach to standards and how they were developed, what guided the revision process, let's talk about when these changes take effect and what the implementation timeline looks like for you. Take a moment to look at a couple key dates you want to mark on your calendar. First, yesterday, April 1st, 2025, was when we implemented updated survey processes. That means surveyors have already begun using revised approaches and processes to conduct their on-site evaluations. It's important that your team is familiar with what's changing on the process side as well as the standard side. Talk a little bit more about that in a second. On April 7th, all of our revised standards manuals will be taking effect. Again, the 1st and the 7th are key dates to prepare for. If you haven't already started using and reviewing the standards manuals and understanding those alerts that we've been sending you since probably October or November, I would encourage you to do so to align your internal practices and prepare your team for a smooth transition. There's plenty in the manual that has not changed that you can continue to use. Focus in on what has changed to make sure that your team is ready. Talked a little about technical corrections before, but I want to just dig into it a little bit deeper. These are necessary updates to some of the Quad A standards. They occur when an issue arises that cannot wait until the next version of the standards are published. These technical corrections and technical change documents are a vehicle to rapidly communicate to you and to surveyors the priority standards changes that you'll need. These corrections supersede any standards that precede them in the standards manual. The first corrections, as I mentioned, have already been published on March 28th. They will take effect with the broader standards manual on April 7th. Again, these are smaller changes or extremely important ones. And sometimes these are pushed on us by our regulatory partners that have expectations of changes with new technologies. We may issue these corrections at any time, but we will do our best to broadcast those out. So stay aware for our alerts, our newsletter, and announcements, as well as direct mailings that we will make to you on a program-by-program basis should a change take effect within your program. Again, I would expect every program to see technical changes probably throughout this year, because as well-intentioned as our committee was, this was a major undertaking, and there are a few things that slipped through that we need to address. But on an ongoing basis, over the course of the 3-year sort of routine for standards revisions, I would expect that there will be a few technical changes through every program. While many of the revisions reflect broad improvements in structure, clarity, and consistency across the board, there are many program-specific updates that you'll want to be aware of, depending on where you practice, or if you work in multiple facilities, if you have to accommodate different changes in different facilities. In this next section, we're going to highlight what's changed program by program to give you a clearer picture of what your facility should be focusing on moving forward. This is just an at-a-glance visual to help you understand what has changed across each program. The table gives you a high-level summary of where the most significant updates were made and which programs they affect. That doesn't mean there might not have been small wording changes in other areas. What we're trying to do here is give you big red flags that you can go and dig into further. This is a helpful tool for identifying areas you may want to review more closely and devote your attention to rather than the stuff that maybe hasn't changed quite as dramatically. Here's how to read the table. If you see all black, that means that the items or standards within that program area are already applicable to the program and that no changes were made. You can probably rest easy if you're already in compliance. A red X indicates that a change was made for that specific program in this specific area of accreditation, whether it's process or standards. This could be a revision, a clarification, or a newly added requirement. If you see NA, that means the item is not applicable to your program at all and that no action is needed in the area. This, again, is a quick way to pinpoint updates that are most relevant to you without you having to dig through the entire manual right away. We know that can be daunting. In the following slides, I'll break down a few of the other changes in a little bit more detail so you can see exactly what's been updated in a big, meaningful way for your facility. But in-depth overviews of the specific changes in details and with technical advice will be something that we discuss in greater detail in each of the following segments over this 9-week program. For those of you operating in facilities that use anesthesia, so our anesthesia-based programs, essentially anything other than our Medicare outpatient physical therapy program or a Medicare rural health clinic program, you'll notice that Quad A has eliminated the anesthesia class of CM. Only 3 anesthesia classes remain, A, B, and C. We revised these to avoid mandating new practices unnecessarily. What that means is the standards that used to apply to C and CM facilities have been reworded so that we didn't force any facility to become a C facility if they were not using general anesthesia or TIVA. What we did was make sure that the standards were written as such that the facility can have operational continuity and continue to operate as they have, meeting all the new requirements based on how they're worded, but without falling into a new category that just added confusion and complexity to the entire process. So if you were a class CM facility, you will notice that your new requirements and your new certificate will indicate that you're a class C facility. That does not mean that we expect you to start providing general anesthesia and inhaled agents. It just means that you fall into the class and that standards may or may not apply depending on your practices, and they will be worded accordingly. Non-compliance with any item in the document resulting in a deficiency under standard 1A1 would talk about this this change right here, that a CM facility will now fall in the category with C facilities providing general anesthesia. One of the big changes that you'll notice is a change to hospital privileging. Again, this is for most programs in which hospital privileges have been required, which I believe are almost always our anesthesia-using facilities. There is a new standard, 11C6, that would apply. And in this new standard, I will read it to you verbatim just for posterity's sake. The facility must have a written policy and procedure that address the criteria for clinical staff privileges and the process that the facility's leadership body uses when reviewing physician, APRN, and PA credentials and determining whether to grant privileges and the scope of the privileges for each practitioner. Previously, Quad A required that surgeons and practitioners maintain hospital privileges and submit proof of such to Quad A. Now, it is the responsibility of the facility's governing body to determine whether to grant privileges, the scope of those privileges for each provider. This is, of course, must be addressed through a written policy and procedure. And I'll also note that this also includes how you are going to determine whether to grant those privileges. Not just that you do or don't, but you need a set of criteria and a process to determine that you will or will not grant privileges to some professional based on some set of information. This is a slight departure from the past and what you may be used to, so it's an area to definitely focus on. Observation of care is another new process. Even though it is not a new standard, it is a new process to survey that you will be experiencing with the new standards manuals, and in fact has already been made activated. In some cases, our standards committee have been testing this out for several months. Observation of care is a critical component to the survey process. It allows us to see how policies and procedures are implemented in practice, rather than relying solely on documentation, interview, or self-reported information. This helps us understand the facility's workflow, culture, and how patient care is delivered on a day-to-day basis. Direct observation answers the question, does the facility actually do what they say they do in policy, in procedure? This ensures that policies are not just paper, but they're actively followed. This allows observing critical aspects of care. We can identify potential risks or gaps that could not only compromise patient safety, but they could also lead to adverse compliance, and that leads to adverse outcomes. Incorporating observation of care into the survey process ensures a comprehensive evaluation of the facility's practices and helps drive meaningful improvement in patient care. This is a new change for any facility not participating in one of our Medicare programs. For those of you who've been participating in Medicare programs, observation of care in the form of a more comprehensive Medicare case tracer methodology has long been a feature of the program. This is a newly added feature of our non-Medicare programs. And I will say, it can sound a little bit burdensome, but in review of the folks who've been testing this process, there's actually a lot of evidence to suggest that this will lead to a much more efficient, comprehensive, and detailed survey process than interview and reading documents. A couple other changes that we're implementing to enhance accountability and ensure sustained compliance pertain to the I would say to the post-survey process, the corrective action process that you experience after completion of a survey, after the exit conference, and after receiving your statement of deficiencies. The first is the corrected on-site deficiencies. This only applies to our non-Medicare programs, including our international programs. This is something that is prohibited to our Medicare programs. It is not something that we have the power to allow you to do. Even if deficiencies are resolved during the survey, our facilities are still required to submit an acceptable plan of corrective actions. This ensures that all deficiencies are documented and monitored for sustained compliance over time. And I want to take a second to give an example of this, because especially for you facilities that have been accredited for a very long time, this is probably a departure and maybe a little bit of a shock for you. But as we reviewed cases, both investigative cases and adverse event cases and routine cases, it became very apparent that in the example when, for example, a facility has outdated medications, it's pretty easy to waste those outdated medications on site and consider that corrected on site. That's great, and it allows us to leave feeling confident that the facility no longer has outdates. However, what we expect in the plan of corrective action is to look at the root cause analysis and to determine how and why there was a gap that allowed expired medications to be present in the facility, and how the facility is going to guard against that in the future. So we can take immediate action and give you credit for correcting the non-compliance on site, but we still expect a little bit more dialogue, again, to serve that purpose that we've talked about throughout, to set you up for sustained long-term success, because it could easily creep back in. And if we work with you to put measures in place to monitor and track and have oversight, then we help you from having compliance issues in the future. Additionally, Quad A has expanded the 10-day plan of corrective action requirement to the non-Medicare facilities as well. Again, in Medicare participating facilities, they're already required to submit acceptable plan of corrective action for each and every deficiency within 10 days of the survey. We have, I can tell you, for more than a decade, had a soft sell on sort of asking for an acceptable plan of correction to non-Medicare participating facilities. Now our organization, our board, and our committee have decided to implement that in a more formal basis, even in our non-Medicare facilities. So the POC must outline the steps to address and resolve issues, and ensure alignment with Quad A standards. This does not change our evidence of correction mandate. The evidence of all corrective actions must still be submitted within 30 days of the survey to demonstrate the implementation of corrective actions. This has been a hallmark of the Quad A accreditation program for the last 45 years and does not change. The main purpose of having a 10-day corrective action plan as an interim step to actually carrying out and submitting the evidence of corrections is to make sure that you're not going down the wrong path. You can work with our staff, our clinical folks, and our committee with your with your plan of corrective action to make sure that you haven't implemented a change at day 30 that we then turn back and say, well, doesn't quite achieve compliance. Our goal, again, is to help you walk down that path to achieve compliance and set a foundation for sustained compliance. The key objectives of these changes are to require POC for all deficiencies, even though the corrected on-site happens. This requires that every issue is documented, is monitored, and is maintained. And the updated timelines encourage prompt resolution of deficiencies and alignment with the expectations for compliance. This creates a consistent process across all accreditation programs and eliminates confusion and problems with compliance because of surveyors, being used to working in surveying a Medicare facility, then going to a non-Medicare facility. All of these processes align with that consistency that we're all trying to achieve to make sure that all facilities are as safe and compliant as they possibly can be. Interpretive guidance is a brand new part of the standards that we think will dramatically help both facilities and surveyors with the survey process and with ongoing compliance. You'll notice two parts to the notification. This is the layout. If you were to download the interpretive guidance in the manual from our website right now, you'll see that the interpretive guidance is the explanation of the standards. It serves to clarify what the standard is asking for and why it matters. As we said, the why often matters as much as the what, because if there is a deviation, if there is a unique set of circumstances, if you understand the why, you can set out a plan to achieve an equivalency in terms of compliance so that you can get a passing score as opposed to a deficiency. The second part is guidance for evaluating compliance. These are suggestions that we've put together in order for you as a facility to meet compliance. These are not the strict letter of the law, but they are ideas and suggestions for you if you're struggling. They can be advice and help you along. They can also help the surveyors if they run into a circumstance that they've never seen before to understand how they can assess your compliance or your colleagues. In addition to updates and clarifications, we've added entirely new standards across each of our programs. These additions are specific to the scope and setting of care, and we'll be calling those out during each of our later lunch and learn sessions in the following 8 parts of this series. For example, if you're part of an ASC, you'll want to make sure that you attend the segment that covers the Medicare deemed program, since that's where you're going to get into the specifics of each of these new standards specific to your setting, and we'll get into details about compliance and how to maintain accreditation. I know I covered a lot right now, and it was pretty broad and pretty high level. We're talking about the 25,000 foot level, if not the 30,000 foot level. And each of our subsequent sessions will go into a lot more detail. You may already have questions. If you have questions about the standards, whether it's something we've covered today or a more specific scenario that's come up later, or whether it's something that you've observed or reviewed on your own when looking at the standards, the change requests, or providing feedback, we absolutely encourage you to reach out to our clinical team. The whole goal for our clinical team, as well as our entire staff, is to be here to help guide you through the updates and to provide any clarity that might be needed. However, we do ask for a bit of patience. As you can imagine, with a project this big, we're getting a lot more questions, concerns, expressions of anxiety than we normally do. So due to the high volume of submissions and the technical and legal considerations that go into providing a quality, consistent response to your standards-related questions, our team has to work very hard and very carefully to make sure every answer is thorough, accurate, and well-informed. The clinical team will respond as soon as is humanly possible and in the in the order that your questions are received so that each inquiry gets thoughtful attention that it deserves. We normally try to have a very quick turnaround, and we will certainly try to have quick, but quick is relative to the size and scope of these changes and the number of questions we've gotten. Our quick is not as quick as we would like it to be, and we'll work very diligently to get back to that level. But I anticipate that during this transition period, it will take a little bit of time to thoroughly research any questions and provide a really high quality response. We truly appreciate your understanding, and we're grateful for your support throughout this transition. We want to be your support as well, and your questions will allow us to do that. Emily, I think you're still muted.
I was. Okay. Thank you, Tom. That was great. We really appreciate your insights. So now we're going to move into the Q&A segment of the presentation. So if you haven't already, please submit some of your questions to the Q&A function of the webinar, and we'll address as many as possible. And then again, if we don't get to your question during this session, I'm going to send them over to the clinical team, and we will get back to you as soon as we possibly can with an answer. Okay. So this is our group that is going to be joining us for the panel discussion. We have Dr. Janice Islar. She is a Quad A board member, and she is the chair of the Standards Committee. Dr. Monty Goldstein, he is also a Quad A board member, and he is the vice chair of the Standards Committee, and he is also the chair of investigations. We have Shannon Hawkins, the director of accreditation, and then Nikki Zeman. She is a clinical review analyst here at Quad A. So let's dive in. Let me pull up the questions here. So we have quite a few questions. Okay, let me scroll down here. Oh, wow, we've had a lot. Okay, so this is for everyone, and you guys can pick it up how you choose to. How do we use interpretive guidance, and is it scoreable?
So interpretive guidance is, as we said, brand new. And so we anticipated a question about that. And I think Nikki has some information prepared for interpretive guidance and how you can use it.
Like we've said previously, it is really there as a reference and education for facilities. However, some of the interpretive guidance is a little bit more linked directly to the standard. There's and if we reference a regulatory body or something like the DEA, there's a specific standard 65 that speaks to the steps to take when contracted anesthesia brings in drugs, for example. Those would be expected to be followed. So there are some that we expect that will be part of the evaluation process. If there's any questions, we've received many questions, and if there are any regarding what we were looking for, please feel free to send them into standards. But most of them are pretty self-explanatory, whether we expect compliance with small portions of the interpretive guidance.
You, Nikki. Okay, up next is Standard 6F4 applicable for Class A surgery centers requiring neuromuscular blocking agents. This seems outside of the anesthesia definition and airway requirements for Class A facilities.
Well, the good news is we have two anesthesia professionals on here. I don't know which one of you wants to tackle this first, Dr. Islar or Dr. Goldstein. That seems like something that might be part of a technical update.
I'm not quite sure of the standards, so someone's going to have to read it to me. So is it for a Class A facility?
We can do with this question, since we don't have an easily available answer with the standard on the screen. We will get that to you, Lisa. Yeah. Okay, next up, can someone please explain observation of care? Does observation of care mean the same thing as case tracer for the CMS program?
So I'll take that one, Tom.
Absolutely, go ahead.
For you. So I want to be clear to everybody. So observation of care is not the same as case tracer across the CMS program. The CMS ASC program mandates a full case tracer, that a case from start to finish be observed. Observation of care is meant to facilitate as Tom described during his webinar, that there are compliance with the standards. The way we kind of look at observation of care is that a picture is worth 1,000 words, and an observation is worth 1,000 pictures. And it's really just helped the surveyor assist both, in his observation of the facility, and really assist the facility in showing the surveyor that they're complying with the standards. What's going to be looked at is really going to be dependent upon how the facility presents itself and what the focus is and what we see coming through the various surveys, by history. For instance, in the beginning, we might be focusing on items like infection control. Some items that might be snippets that are looked at in the beginning as maybe the initial patient interview, an anesthesia induction, maybe the timeout process, maybe instrument processing in the beginning. We just want to ensure that the facility is operating in compliant with various Quad A standards. And if not, it really gives us the opportunity to intervene and show the facility how they should be operating within Quad A standards before untoward events happens. So there's no requirement that a full case be observed and just snippets. And, this is an ongoing living process, and it's going to be adjusted based on the facility. So it's going to really be facility dependent. There might be just very short periods that will be observed. And it's not the patient that's going to be observed. It's just processes.
And Dr. Goldstein, I do see that there's a question here from a small facility that does not have is not able to get a patient scheduled for the day of their scheduled survey. How do you think we'll be able to handle something like that situation?
So I think we'll discuss that internally. I mean, we understand that this is going to be a generational change like many other changes. So, we'll work with each individual facility to make sure that they're going to be complying with the survey, with standards.
Sounds good.
You scroll back down. Okay. The next question was, are hospital privileges required in the revised standards? So I know we touched on this a little bit, but does anyone have a more in-depth answer for this?
I'll take that one. This is Janice Isler. And the short answer is no. Hospital privileges are no longer required for accreditation in Quad A facilities. But to expand just a little bit more, and Tom touched on this earlier, it is the facility's leadership responsibility to ensure all healthcare providers are qualified for the procedures and tasks to be performed in the facility. And credentialing must be done through primary source verification. And just a very, very quick example of that is we all have our little license cards that we can print out from the Board of Nursing or Board of Medicine, but it is no longer, the facility cannot accept that card that the healthcare provider brings in. The facility must go directly to the Board of Medicine or to the Board of Nursing's website and actually see that that person is truly licensed to practice in the state and at the location. Other forms of credentialing may be the education and training, the state law for the location for the facility, the National Practitioner Database. But the bottom line is hospital privileges can be used, but they are not required. And it is up to the facility leadership to make sure that everyone is educated and trained for the procedures performed in that facility.
Roll back down to the next. So we are hitting the 2 o'clock Eastern, 1 o'clock Central. So we're going to maybe just go over a couple of minutes and answer 2 or 3 more questions. And then all of the questions we did not get to, we will make sure that we get a written response over to you guys.
And we'll distribute that. We'll distribute that written response to the entire registrant list so that it's not specifically only to the person who asked it, so that you all could benefit from the shared knowledge. Is that right?
Yes, absolutely.
Okay. Thank you.
So the next question is, if my facility does not use any malignant hyperthermia inducing agents, why do I need to have the algorithm on my crash cart or run drills? Seems unsafe practice to clutter my crash cart.
I'll take that one too. That was a change that the standard that had been before that you needed to have a malignant hyperthermia protocol and algorithm on the crash cart, yet you did not use any triggering agents, nor was it even used ever in the facility. There was no dantrolene. We removed that standard, so that is no longer required to have the MH algorithm. However, what we do think is very important for all healthcare providers in the facilities to be aware of malignant hyperthermia as a potential adverse event in that facility.
So I wonder, because that's something that could get really detailed. So can you correct me if I'm wrong, either of you, Dr. Isler or Dr. Goldstein, if you do not have inhaled agents, if you do not have the regular use of succinylcholine, you do not need the full complement. If you keep succinylcholine just for emergent airway rescue, you do not need the full complement. If you go over into routine use of succinylcholine or use of inhalation agents, that's when the malignant hypothermia kicks up. So is that, I think we clarified that. That was always the intention, but it wasn't worded very well. And so the intention was to kind of make that more clear and better. Is that correct?
Yes.
Thank you.
And that's correct. But we also have to defer to states. So we need to make that clear as well. There are certain states that require full complement of malignant hypothermia accoutrements if you have 1 vial of succinylcholine. So as always, the strictest rule applies. So if you're in the state of New Jersey, as an example, that state's rules supersede Quad A requirements. So even though we allow for succinylcholine for airway rescue and do not need the malignant hypothermia protocols and accoutrements, the state of New Jersey would still require that.
You. Okay, we're going to do 2 more questions live today. So let's go with the next one in order that was submitted. Is performing surgery on the day of an in-person survey mandatory?
That goes back to observation of care, so we'll kick it back to Dr. Goldstein to expand.
So we do have to observe care in the facility. So we're not going to necessarily performing a procedure and or surgery or some type of care in the facility is mandatory as of April 7th. And the scheduling team will work with you to ensure that we can perform an adequate survey. The short answer is yes.
Some kind of care. It might not necessarily be a surgery, though, right?
Yes, observation of care. Correct. So I did say surgery, procedure, or some form of care of that.
Okay, 2 more because these are short ones. Is standard 11C6 relevant to RHC clinics?
That was the hospital privileging change. I don't believe the hospital privileging requirement existed for RHC before.
Yeah.
Are the proceduralists required to have BCLS and ACLS?
Yeah, so one of the requirements to, so the way those standards are all written, and Janice, please correct me, is one member of the team has to have ACLS, one member of the operative team has to have ACLS, and then the remaining members of the team have to have a minimum of BCLS. One requirement for ACLS is BCLS, so that everyone understands. So the ACLS actually BCLS is not a part of ACLS. So that requirement, the person who has ACLS training actually required to have both. So it's not required that everyone have ACLS training. It is required that one member of the team have ACLS be present in either the procedure suite or the operating suite at all times. So I think that's clear. So it doesn't necessarily.
Thank you for adding that clarity, because my legal training was about to go off and think, it can't be just one member of the care team who might not be there when care is going on. It has someone has to have ACLS at all times.
At all times there. But to be clear, so someone who has ACLS also has to have BCLS. There is a technical correction which might occur in the future. There is an anesthesia, an ASA course that is offered that's called PEARL, which is being considered as a substitute for ACLS training, which does not have an airway didactic. That is not currently in the corrections. That in the technical corrections.
Okie dokie. So we have quite a few questions that we are going to have to answer and provide in writing. So I will get these over to the clinical team and the folks here on the panel today, and we will get those questions over to you as soon as possible. There's quite so many great questions. So thank you guys so much for submitting them. And so I just want to also, before you go, let you know that we really appreciate your time today, and we thank you for joining us. We hope that you found this as valuable as we hopefully think that it was. So before you go, we do have a survey that is going to be going out to you guys. So we really appreciate it for feedback. If you'll just take a few minutes and fill that out. I think it's only 5 questions. So your input really helps us kind of guide how we're going to structure things in the future. And so also just wanted to let you know that the next webinar series, if you did not already register, you can register for that. It is Maintaining Compliance. It's a part of the series. So it's Accreditation in Transition, how the new standards are reshaping the process. And that is going to be on April 9th at 12 Central, so noon Central, from 12 to 12:30. So we'll dive deeper into the accreditation process itself and what that means for your facility. And then also be sure to follow us on our social media pages. We're always putting information out there. And tune into our podcast. I think we have 8 or 9 episodes available online on our website. You can go listen to those, or you can access the podcast wherever you get your podcast from. So Spotify, Apple, I'm not sure where else. But so again, thank you guys so much for being with us today. And we look forward to seeing you guys at the next webinar.
Yeah. I just want to say one thing too with regarding the social media and everything, make sure you're on our list for our newsletter. A lot of the alerts and things about these standards that we've been publishing for months, we distribute through the newsletter and through the social media so everyone can see it. And I did see a couple of questions that led me to believe that people maybe didn't see or they thought there was a very short window to start preparing for the accreditation under the new standards. But I can assure you that we've been publishing notices, including some pretty comprehensive materials for several months. And so if you're not getting those, please be sure to check that you're on the socials and that you're on getting the newsletter and that you're getting the email blast too. If you're not getting emails from us pretty regularly, make sure you talk to your accreditation specialist and make sure that we've got the right email for you. You can unsubscribe if stuff gets too much, but I just don't want you to miss valuable compliance kind of information. So thank you.
Thanks, guys.